Pennsylvania's state system of higher education. 14 universities, infinite opportunities. This week, we'll learn about programs that focus on health and wellness at universities throughout the state system. But first, we'll hear from Jeff Lynn, coordinator of the Exercise Science Program and assistant to the Dean of the College of Health, Environment, and Science at Slippery Rock University.
Hello, I'm Frank Brogan, the Chancellor of Pennsylvania's State System of Higher Education, and delighted that you've joined us for another episode of Infinite Opportunities. Our opportunity to tell the people of the Commonwealth of Pennsylvania a little bit more about the 14 wonderful universities that make up our system and what the over 100,000 undergraduate and graduate students are up to these days in Pennsylvania's state system of higher education. We really have a unique opportunity today to talk about something that is literally important to everyone watching this program. That's the issue of health and wellness. But while we say that, it's a very complicated issue, and it continues to evolve with the times and as times change. We're really lucky today to have with us Dr. Jeff Lynn, who is with Slippery Rock University. And Dr. Lynn, you have a myriad titles, so I'm going to read them from my sheet. You are Associate Professor and Assistant Chairperson in the Department of Exercise and Rehabilitative Services. You are also Program Coordinator, Exercise Science, and Assistant to the Dean of the College of Health, Environment, and Science at Slippery Rock University. So we are very happy to have you, and also with those credentials, give you the opportunity to clarify for our viewers a little bit more about what is health and wellness in the 21st century. And I'm going to start there. It is a complicated issue. It's easy to think of health as doctor-patient. That's a very tiny part, as important as it is, of all of health and wellness. Tell us a little bit, Doctor, about health and wellness from your perspective in higher education.
Yeah, happy to. To start out with just health and wellness, those definitions get kicked around quite a bit and get used in a lot of ways, especially probably in the last several years, because the physical health that you talked about is part of wellness. So I'll start with wellness because it's an umbrella term that has a lot of facets or components to it, and physical health is just one of those. So wellness is a multi-dimensional approach. It's a holistic approach to well-being. And so it includes physical health, but it includes emotional well-being, intellectual well-being, occupational well-being, even how you interact with the environment and your spiritual well-being. So it's very holistic. That being said, I would say that a lot of opportunistic folks have hijacked the term wellness for profit. So that we have to be very careful, because everyone is able to hang up their shingle and say, I'm a wellness expert, and in the name of profit, make quite a bit of money on things that are hokum, or let's say non-scientific. So we do have the opportunity at Slippery Rock University to spread the word of what wellness and health truly are, and to make inroads into the health and wellness of our students, because they're the ones that are going to go out in every direction and take it from there. So we're fortunate to be able to share the truth on campus.
Well, at Slippery Rock, to that end, you have a fascinating initiative that is called Exercise is Medicine. Can you tell us a little bit about that?
Yeah, this is very exciting for us because we didn't come up with it. This was an initiative that was a joint project between the American Medical Association and the American College of Sports Medicine. And we have decades and decades of research that show us that if exercise were a medicine, it would be the most powerful medicine, both as a preventative medicine and as a treatment for dozens, if not hundreds, of different human ailments, both physical and mental. And so the fact that we don't use exercise as medicine really makes little sense. So the initiative really was to try to put exercise in the medical paradigm, such that when you go to a physician's office, they're still going to take your blood pressure, they're still going to take your heart rate, but maybe they would start asking you, how much physical activity do you get? And why might it be important to you to stay active and have physical health and wellness? And this isn't common. I think most people watching this program probably have not had that experience in the doctor's office, yet probably they should. So that was the initial idea for Exercise as Medicine, and then it really blossomed and spread out into many, many other initiatives, such as Exercise as Medicine on campus. And we are a strong player at Slippery Rock in that game, and in fact have been recognized internationally as having an excellent prototype for bringing exercise onto campus to help health and well-being of our students.
And it's all right to brag a little bit. You want to tell us about some of the global recognition that you've actually received at Slippery Rock for your program?
I'm happy to. I'll be unapologetic about our success because it's taken a lot of hard work from the people that I work with, and I'm happy to be part of a really strong and passionate team that had a great vision and is going after it. And what we did is we submitted to a call for it's called the Active U Challenge. And the American College of Sports Medicine sent this out to universities all over the world and said, what are you doing on your campus to make people healthier and more active? And we submitted everything that we do, and we won. We were considered to have the best plan in the world for a campus to be active and to be healthy. And so that was just a couple of years ago, and we continue to build off of that.
What's the profile of one of your students? Do they come from any particular walk of life? Do they come from any particular background? What do you find by way of interest for students when they're moving toward programs like yours? Where do they hail from?
Well, everywhere. Because we are where we are at Slippery Rock, we get most of our students from within 50 and 100 miles. There's no doubt about that. But our reputation has been growing, and whether you call it reputation or brand, it's strong. And so for that reason, we're seeing more students coming in from around the country. So stretching out into the neighboring states and further. And for a lot of reasons, but Slippery Rock is truly a powerhouse when it comes to health, wellness, and fitness. It has been for a very, very long time. It used to be physical education, but what happened is that spun off athletic training and public health and exercise science and so on. And now all of those programs are doing amazingly well. And so we are drawing in students who are eager to be healthy and well, but to also make that their career.
Well, another part of your resume includes status, and it is as co-chair of the President's Wellness Commission. That not only brings prestige to the university, but to the Commonwealth, and very much, I would suppose, great attention to this issue. Tell us a little bit about your experience in that regard.
Well, we knew that there were a lot of people on campus doing great things when it came to health and wellness. But sometimes in a slightly disjointed fashion. So the idea was, let's get all of these experts together, call them champions for health and wellness, put together a committee, and let's coordinate our efforts and find synergies and see if we can put our stake in the ground to say that Slippery Rock University is one of the, if not the most healthy campuses in the country. And so we started to do that. And the president of our university saw pretty quickly that this is more than just a committee. This needs to be a commission. So President Cheryl Norton said, I want this to be a commission on wellness, and so it became that, and I became an early leader. And now what we're doing is coordinating a lot of initiatives on campus in order to create a culture that truly embraces wellness, both in the students and the faculty and staff. Because we don't think that just aiming it at the students alone is the right idea. They come and go. We have a turnover, as you know, every 4 years. But if we can create a culture that everyone on campus embraces, we think it can live infinitely, and we can truly be what we're trying to be, which is the most well campus in the country.
Well, first of all, my hat's off to all of you at Slippery Rock, and I want to commend you all for the attention you're putting on this issue. It is really, I think, an ever-evolving, but a more important part of our daily lives. Not just the ability to be healthy, but everything that contributes to that. And I think rightfully said, as you did, all of the things that fall under that rubric, including not only what we do, but how we feel and how we think. Mm-hmm. And I really applaud you for it. We could talk so much more about your accomplishments at Slippery Rock, Dr. Lynn, but I just want to thank you very much for being a guest on Infinite Opportunities and sharing with us some of these concepts, but more importantly, what you do for the students at Slippery Rock University. We all appreciate that.
Thanks for the opportunity.
Thanks for being with us.
Mm-hmm.
Next, we go to Slippery Rock University to find out how the study of exercise science promotes activity as a way of life.
It's very common for people not to know what exercise science is. From program to program, university to university, it's not the same. You've almost got to look at what is exercise science at Slippery Rock. We are the preparing scientists. And what is science? It's a method of epistemology. It's a way of thinking. It's a way of going about building knowledge. And so we use exercise as medicine, and we teach people to think as scientists to solve problems, including humans. So exercise science at Slippery Rock University is a human science.
I believe that the exercise science program at Stroudsburg University is among the best in the country because we have a group of faculty who all have a mission to make this program the best program that can be.
And what we did is we went and found people not because of necessarily their expertise in the content, but because they really wanted to work with undergraduate students. They had a passion for it. And the other thing that we looked for that you had to have to get hired in this program is competitiveness. And so when you've got that sort of culture in your program, we've got these people that are enthusiastic, they buy into the mission, they can't stand to lose, and they want the students to do well, you end up with this energetic situation that creates a wave that you just ride, and we ride it to success.
The faculty are also committed to making themselves better teachers. So over winter break or over summer, we are consistently trying to improve and change up our pedagogical strategies.
We as a team in Slippery Rock Exercise Science have gotten together, and we continually meet to build into our program specific things that will make our students better problem solvers and critical thinkers.
Really get engaged in their learning and have opportunities that other students at other institutions might not. Always using the students as advocates of what we do, and that's what we tell them. You are the emerging experts. You are the one who's going to carry the torch. We teach them early on how to be that professional, how to engage others, and how to make a difference in their communities.
We have developed a culture of rigor, and it is not normally what students are accustomed to when they come from high school. So they've got to make an adjustment, quite frankly. And most of them do, because what we've learned is that if you set the bar high, and you demand excellence, most of the students will get there.
We have physical activity as a daily facet of life. That's the kind of culture we're trying to create. So if you come to a university where there's a major focus on health and wellness, I think that's pretty powerful. So we're saying we're not only interested in the academic success, we're really concerned about their health and wellness, and we are going to provide opportunities for them to be more active, and we're also going to give them the behavioral tools necessary to exact those changes toward lifelong fitness.
We really take something that we stress in our own program, and that is the faculty are going to hold the rigor very high for the students, with the idea that by the time they leave here, they're not going to accept anything less from themselves than excellence and high rigor.
I think it's our duty to make sure that we provide these opportunities for students and faculty and staff and administrators, but also give them those tools, make it so that it becomes a part of their daily life beyond college.
We don't just spark minds. We set them on fire. We build character. Character builds success. Celebrating 150 years.
Welcome back to Infinite Opportunities. Next, we go to East Stroudsburg University to see how health-related programs at the university provide outreach in the local community.
The mission of our College of Health Sciences is to educate future practitioners in the fields of public health, healthcare delivery, health education, in order to make a contribution to improve the quality of life, not only in Northeast Pennsylvania, but in the world. We educate our students to become the best healthcare providers that they can be, and also with a sense of giving back and being integrated into the community. So it's a mission of both education and service. Integrating students into the community is this idea of the experiential pedagogy, where students learn by doing, and why not do that into the community and also providing a service where students can learn about their community. So one of our bigger programs that we have on this is our Health Coaches program, where we work with the Pocono Medical Center.
And actually teach them a semester course in chronic disease and chronic disease management, as well as patient interviewing, how to motivate patients and change behaviors, and actually take them after they've completed the course and have them become health coaches by going out into the community and seeing patients in their homes.
So here we are, we have students who are during learning from books and slides and lectures, but also now having to have that additional experience.
It's been very rewarding, and I have been amazed how well the program has done.
I was in the first Health Coaches program at Pocono Medical Center, and now I'm in my second year of medical school at the Commonwealth Medical College in Scranton. I thought the whole program was very beneficial to me because I got to see the big picture of healthcare, not from just what I would see as a doctor. I get to see all the other aspects that influence the patient's health.
I think it gives them a sense of how to have a relationship with a patient, and that's always a learning curve. When you ever go into a health science, it doesn't matter whether you're going to be a physician, whether you're going to be a physician's assistant, a nurse, a respiratory therapist, a radiology technician, you have to start to be able to have relationships with patients and deal with them. And this is a great segue to be able to start that program.
I thought it was a big leg up on everybody else, because here, especially at TCMC, we have that patient-centered approach where we have to think about how this affects the patient. And when I was there visiting people in the home, like I said, I saw a bigger picture of what healthcare was, that this treatment with this patient is much bigger than just me being in a room talking to them. That might only be a small portion of the entire healthcare plan.
So we believe that it's important for students to get educated, and an education is more than a classroom. It's really about going beyond the classroom and having them learn as they experience.
I think the partnership between Pocono Medical Center and East Stroudsburg University has been really a great thing, and we're even now exploring more things that we can do together in the future. But this is one of the, I'd say, a cornerstone thing that we've developed with them with this health coaching program.
We're anchor institutions in this community that can really make an impact into improving our quality of life. So we have to be able to be collaborative partners at that level.
It really has worked out unbelievably well. And the patients love it, the student really gets a good experience, they seem to like it, and they get credit for doing it. So it's really it's a win-win for everybody.
Focus on success. Since 1837, Cheyney University has been preparing thousands of young men and women to become successful leaders in the fields of business, arts and science, education, and professional studies. At Cheyney University, you'll not only receive an affordable, quality college education, but the attention you deserve from faculty who care about you and your success. Focus on success at Cheyney University.
Welcome back to Infinite Opportunities. Next, we go to Westchester University to discover how physical activity and nutrition programs help various groups throughout the community.
All of my work deals with school-aged youth. The Center for Healthy Schools started 5 years ago here at the university, and we are a core connector between public and non-public schools, community groups, and our focus is healthy students and also linked to academic success and learning. In past, approaches have always been that health issues of kids stayed with the typical health practitioner, a school nurse, a physician, like a sort of traditional model. As kids' health issues became really more complicated, it was really obvious that we had to look at the impact that was having on kids doing well in schools. So the center's job is to merge the conversation so that when we're talking about a healthy school, we're looking at health and wellness strategies as a means to student test scores improving, to kids being able to come to school and not miss school, to increasing graduation rates. Healthy kids we know are better learners. It's like really a simple idea. People talk about legacies or making a difference, and to me it's always been making a difference in somebody's life in terms of their health, and then the impact that has on their ability to be successful in school, to graduate, have the career they want, the family, whatever it is that they plan for their future. Health is such a great determinant of your success in being able to do that, so it's very personal. So for me, it's kind of easy to be motivated and feel rewarded just because of the impact you know you've made.
I'm a speech-language pathologist, and before I became a speech-language pathologist, I was a singer. I actually took a course as a senior called Care of the Professional Voice, and it was taught by a speech-language pathologist, and I said, this is what I have to be doing. The largest group of people who've been studied in my field are teachers, and there's a large prevalence of teachers who have voice problems. And so there's been studies that looked at the societal impact, the economic impact, actually the students' learning abilities and how they're impacted in the classroom. So I'm actually looking at designing a telepractice model for voice disorders related to teachers. And I'm actually doing that here at Westchester University with student teachers. And I'm going to compare that online model to a traditional in-person model. You know, the grant that I've applied for is an Area R15. It stands for the Academic Research Enhancement Award. And that grant is meant to encourage student involvement. The students are involved in helping me to do the research. So I have undergraduate students as well as graduate students in the first year. Undergraduate students are helping me design the app, pilot the app, test the app, put it all together. The second and third years of the grant, graduate students are going to help me with the telepractice and the in-person model. It's our job to, as speech-language pathologists, to think about how we can encourage community people to use their voice to the best of their ability to prevent problems. The desire to help people improve their voice is prompted me to go into the field.
I feel that my lot in life, if you want to call it, is to help people become empowered through physical activity, nutrition education, and wellness activities. When I graduated from college, I went right on to my master's, and that's when I realized I really wanted to help people with disabilities because they seemed like they were marginalized. And when I started to look at people who were very successful, actually like maybe in wheelchair sports, those people had much more control of their lives. They felt empowered, they felt like they were self-determined, and they were able to do many more things because of their involvement in physical activity. That's kind of where we started the adapted physical activity programs. And we started on Wednesday nights with 9 children in the gym and 9 graduate students. That program has grown tremendously. We have 45 children with disabilities and 45 Westchester students who come together for 75 minutes, and we do cooperative games, fitness, motor skills, pre-sports, sports skills. And then I kind of branched out. When one of my colleagues, Kat Ellis, came on board about 7 years ago, we started then a program on Monday nights for transition age youth. 3 or 4 years ago, we got our colleague Jeannie Subak involved, and what she does at the end of that night is she teaches a nutrition lesson to 20 young people with cognitive disabilities. So we brought in the nutrition piece. So we have a program on Monday nights with 20 young adults with cognitive disabilities and 20 Westchester students. Then Dr. Subak comes in and does a nutrition lesson, and she brings 6 or 7 of her nutrition majors. And that's really a pretty solid training ground for people who are going into health and PE teacher cert, and then pre-physical therapy and pre-occupational therapy. The programs have made a significant impact on Westchester students' lives, like nobody's business. It's really something. So I think that I'd like to attract more WCU students to take the classes, to be volunteers in the program, and in general to transform more students' lives. Every time at the end of every week, every program, my students just have this glow about them, that they were part of something way bigger than themselves.
Welcome back to Infinite Opportunities. Next, we go to California University of Pennsylvania to see how students take their love of an outdoor sport and turn it into a career opportunity.
Professional golf management. It's a unique blend of taking a passion for the golf industry, combining it with the skills in business and sport management to make sure that our students are truly the managers of an entire golf operation.
This program is not just about playing golf, it's also about completing your college degree. You take all the same courses in general education as other students on campus. You will get an introduction to the business world, to golf, to sport management. You'll learn about legal aspects of sports. You'll learn about economics of sport.
There's way more to it than swinging clubs. It's all about the business. It's not all about playing golf.
The golf industry has a total economic impact of over $176 billion. That comes down to everything from facility acquisition, supporting staff and hiring, to marketing, to budgeting, to looking at accounting statements, to make sure our students can not only manage a golf facility, but they have the transferable skills in any business realm.
My name is Michael Casino. I'm a graduate of the program and I'm a golf professional at St. Clair Country Club. Every day I've drawn from what I've learned at Cal U. I walked out the door knowing that I was going to get a job in the golf industry.
Our facilities at Cal U are literally second to none. We've got an expansive indoor facility with an indoor chipping and putting green. We have our golf club fitting and repair studio where students can literally take a golf club apart into its components and construct it back to exact specifications. We've got 3D analyzing equipment, 2D analyzing equipment, force plate and balance technology. It literally is a full realm and wealth of information available to our students.
I feel like I've started to build a network of other professionals.
Because our program is really the perfect size, we get to know each of our students on an individual basis, as do other students in the program. This allows our students to network with each other, for our alumni to stay heavily involved, and for our students to have access to a broad range of opportunities once they graduate.
Our program provides a wonderful return on investment for our students. Not only do we have a 100% job placement rate, but our students get internships at literally some of the best places in the world.
My internships have paid off, and that's where I think we gained an advantage. Day one, I was 100% ready because of the skill sets I learned at Cal U and through my internships.
I love this school. I love the individual attention. I love the student body.
The Professional Golf Management program at Cal U is really an exciting blend that takes a student's passion for the game, combine it with a core in business, and send our students out into the industry with the skills that they need to succeed.
Come back next week to learn more of the infinite opportunities at the state system's 14 universities, or visit us online